about your smile a little bit this morning. Not so much the superficiality of your smile, although I'm sure that's bright and shining today, but let's talk about the health of your teeth and what you do if your teeth are giving you a problem. Lucky for us, Dr. Hogan Whitmire is on the show. He's a Chattanooga native. About 2 years ago, opened up the Chatt Implant Center. Great to see you.
Yeah, thanks for having me.
Walked into my office this morning, there you were sitting, and I said, well, I already know your reputation. I have a friend who came to see you, and he couldn't be happier. So you are helping people not just with implants, but that's a lot of what you're doing. Is that right?
Yeah, correct. That's pretty much all we focus on. So the big thing for us, our biggest procedure is really just the full mouth reconstruction with dental implants.
You are a general dentist, but you focused a lot in your postgraduate time with this implant.
Yes, correct. So post-dental school, did a residency where really we just focused on, dental implants, bigger surgeries and sedation.
Okay, so let's get into what this looks like then as an implant. And as we talk, you can go on their website, which is Chatt Implant.
Yes, chattimplants.com, yes.
And you can kind of see as we talk, because transparency is really big for you. You spell it all out for people.
Oh yeah, that's been great for patients, and that's something I really wanted to make available, was just the transparency of exactly what we do. So if you go to our website, you're going to see all of our different treatment package options, as well as all of the prices. So I want patients to be able to go to that, use that as a resource before ever really stepping in our door, so that way they kind of know what they're already getting into.
Okay, I want to ask you a few questions.
Okay.
So is it true or false that you can just be born with sensitive or problem teeth, that some people have stronger teeth than others?
Yeah, we've seen that a lot. There really is, a hereditary genetic factor that does play into your teeth. So, we see a lot of patients that, they've just struggled with bad teeth kind of their whole life. And then others, maybe have not made the best, life choices in terms of taking care of their teeth, whether they just weren't educated on really how to care for their teeth. And then a lot of cases too, we see a lot of patients that are dealing with, certain medical conditions,
right,
and they're on a lot of medications that they take daily and have taken it for years. And a lot of times being on those medications can really affect your teeth. Okay,
because you are getting in there and somebody comes to you. Do you have a typical patient, by the way?
Yes, so we definitely have a typical patient. These patients, they have bad teeth, they have loose teeth, they have bad breath. They're missing several teeth already, or missing teeth completely. So, they may be struggling with a denture. And overall, a lot of the patients are just really lacking confidence in their smile.
Right.
So, and also too, the typical patient, we see this a lot, is, they don't want to go to multiple locations and see multiple doctors. So, kind of a combination of all those things that make up our typical patient is kind of what we've catered to.
When I mentioned at the beginning about, let's talk about your smile and not the superficiality of it, that's not to imply that having a bright, shining smile is a superficial thing, because when you smile big, it's an indicator of how you feel on the inside.
Yes.
And I bet you see so many people who say, I've never been able to smile with my teeth showing.
Right.
Before.
Oh yeah, we see that. We've seen that a lot. We especially see it with some of our male patients.
Really?
Like we notice that when they've come in for the consult or their pre-op, a lot of them have a big beard or a mustache to kind of hide up, some of their bad teeth. And then a lot of the women too, they'll try to speak without showing any of their teeth, and then they'll speak with their hand kind of in front of their mouth. Yeah, we see a lot of that.
Okay, let's go back to some of those before and after pictures that we're looking at, because they're pretty remarkable, really. First of all, I notice how you don't really change the facial structure of a person.
Right.
So they're a little bit brighter in their smile, but it's not altering their face. They still look like them, just happier.
Right. Yeah, you can just kind of see it overall in how they smile. You can see how their eyes kind of change. You can see, that they really have for the first time in a long time are kind of learning how to use these new muscles in their face that help them smile that they've kind of avoided using over all these years.
It doesn't take a long time to recover. Like in a situation like hers, I don't want to pry into her life too much.
Right.
But did you put all new teeth in for her, or is it just a few?
Yeah. So in that previous case with the female, she had an upper denture, and then she only had a few teeth on the bottom with a partial denture. So the teeth that she had were something that would come in and out, and so she had been just struggling and dealing with the denture for years, and didn't even really know that what we offered was available to her.
Because this becomes permanent. I mean, you are implanting these.
Right. So in her case, we go from a set of teeth that come in and out to a set of teeth that screw in, and you're not able to take them in and out. And so that's really a game changer for them in terms of functionality and also, cosmetically.
Once they're in, is the care the same as you would for your normal teeth? I mean, just brush them every day but they can't get a cavity because they're not real teeth.
Right. No more cavities, no more root canals. But yeah, you still are going to take care of them. You're still going to brush them. You're still going to floss them. The biggest thing that's helpful for maintaining and caring for them is the water pick. So that's something we will go over with all of our patients on how to care for them. We try to make it as simple as possible. But yeah, there is a maintenance period, and we also we handle that as well. So really, with us, we're a one-stop shop, and patients love that. That's what they want to know. That's when they come in the door. Some of the biggest things they want to know are, well, how many different places do I need to go to? How many different doctors do I need to see? And overall, how much is this going to cost me?
And all of that you can see on the website. That's that transparency part. But as you're looking at the pricing, remember what he said. No more risk of a root canal or a crown or a cavity or any of it. So it's really an investment into your life ahead.
Correct.
So welcome back to town.
Yeah, thank you so much. Glad to be back.
Chattimplants.com is that website where you can see it all. There's their phone number, 910-9000. They're up on Hickson Pike in Chattanooga. Chatt Implant Center.
I wanted my kitchen to be perfect